Good evening, students. So today we are here with this integrated session on fungal diseases and STIs, a very high yield topic. Myself, Dr. Sonu, and with me, Dr. Manish.
Hello students, so I am Dr. Manish and today we will be discussing all the important topics which have been recently asked in various exams related to two important infections. One is fungal infection and other one is STI infection. अभी के एग्जाम में आपने देखा होगा कि बहुत सारे क्वेश्चंस इन टॉपिक से आए, जैसे टीनिया कैपिटिस के ऊपर कितनी बार क्वेश्चन आ चुका है, पिछले 5 साल में कम से कम 3 बार क्वेश्चन आ चुका है. रिसेंटली STI इन्फेक्शंस के ऊपर भी बहुत सारे क्वेश्चंस आए हैं. सो दैट्स व्हाई वी हैव सिलेक्टेड दीज टॉपिक्स एंड वी आर गोइंग टू डिस्कस देम in an integrated manner so that you can understand and correlate that what is the clinical findings and what are the investigations which are required. So shuru karte hain sir.
Yes. So guys, you should also participate up and try to tell up in the comment section that what you think regarding that image or that question, what is the answer, and then we'll discuss up regarding that. Okay. So the first image is this. So guys, can you tell me which particular picture this particular one holds up? Yes. Good evening, Priyanka. Good evening, Roshan.
So I hope this is visible on your screen. तो आप देखिए और बताइए कि आपको क्या लग रहा है, इसमें क्या डायग्नोसिस होगा.
Yeah, now it is visible. So you can tell up what this particular image is about. Yes, in the comment section. English के ऊपर आगे comment. English sir.
Okay, so
both will speak.
So don't worry, if we say anything in Hindi, we are going to repeat it in English. Okay, so don't think that something will be missed. Okay, so because there are Northern India students as well and Southern India, so remember that if we are saying anything in Hindi, we are going to repeat it in English. Okay, so you won't miss anything. So let us discuss this image. This is a clinical image. Okay, so because this is a clinical image, so let me discuss this and then we'll go to the investigation part where sir will discuss.
They are telling up regarding
okay.
Prion.
Yes, so many of you have answered correctly. Yes, Priya and Mayank and Med Psycho, Vidyapuri. Yes, all of you are correct. This is carry-on, and as you know, this is a very important topic. And what you can see here, you can see that the patient has presented with a tender boggy swelling. So tenderness you cannot see from the image because that is a finding of palpation. But what you can see is, you can see a swelling. So you can see a swelling and as you can see that this swelling is, if you touch it, you will find that it is slightly soft or boggy to touch, and then the patient feel the tenderness. So whenever you find what? Tender boggy scalp swelling, it is present where? Over scalp. So whenever you find tender boggy scalp swelling, the first thing which comes to our mind many a times is that whether this child is having some infection, because there is one more finding which is associated, and that is lymphadenopathy. So this is the common presentation and this is common in children. So these are the points which are generally mentioned in the question. तो जब भी क्वेश्चन आता है, क्वेश्चन में क्या लिखा होता है? एक बच्चा, that is child, presenting with tender boggy scalp swelling with enlarged lymph nodes. Like recently question came that 10-year-old boy presented with tender boggy scalp swelling, enlarged occipital lymph nodes. Which investigation to do? So this is a case of carry-on, and in carry-on which investigation we do? KOH mount. Okay, but sometimes the first option is bacterial abscess, and some students they get confused because bacterial abscess can occur in children. That can also present with lymphadenopathy and that can also be tender or painful. So if first option is bacterial infection or bacterial abscess and you get confused, then always look for one very important point which is generally mentioned in the question, and that is easily pluckable hair. So easily pluckable hair, this is one point. So easily pluckable hair, this is one point which you should look for in that question, because if you pull the hair of a child suffering from bacterial abscess, what will happen? He will pull yours. It is such a painful condition, isn't it? True. So patient is not going to allow you to even touch that. But here if you pull the hair follicles, they easily come out और patient को pain भी नहीं होता. तो अगर ये point लिखा है तो इसका मतलब fungal infection की बात है. कौन सा fungal infection? Taenia capitis. And Taenia capitis का कौन सा type? Carry-on. अब क्योंकि कैरियन के ऊपर कई बार क्वेश्चन आ चुके हैं, तो हो सकता है अदर टाइप्स के ऊपर भी क्वेश्चन आ जाए, तो मैं बस उनके नाम बता देता हूं एंड फिर हम इन्वेस्टिगेशन पार्ट पर चलते हैं. तो अगर हम टीनिया कैपिटिस की बात करते हैं, tinea capitis, it can be broadly divided into two types. It can be inflammatory and it can be non-inflammatory.
Right.
कई बार एग्जाम में क्वेश्चन पूछ लेते हैं कि टीनिया कैपिटस में हेयर लॉस भी मिलता है, तो ये हेयर लॉस कौन सा हेयर लॉस होगा? सो विच टाइप ऑफ हेयर लॉस इज सीन इन टीनिया कैपिटस? सो रिमेंबर दैट व्हेनेवर देयर इज इन्फ्लेमेशन, व्हाट हैपेंस? स्कारिंग occurs. So this is leading to scarring alopecia, and non-inflammatory causes non-scarring alopecia. Now what are the types? The types are, inflammatory is further divided into two types, carrion, favus, while non-inflammatory is divided into two types, that is black dot and grey patch. So these are the four types of tinea capitis. These two are inflammatory type and these two are non-inflammatory types. These two cause scarring alopecia and these two cause non-scarring alopecia. Okay. Now there are various points which you should look for. Like I told you in carrion, you have to look for various points: tender, boggy, scalp swelling, easily pluckable hair follicle, common in children. But if I give you one point, क्योंकि many a times students को लगता है कि इतनी सारी चीजें कौन याद रखेगा, एक most important point which you should look for is boggy swelling. तो अगर आपको swelling मिल रही है, if you find swelling, then examiner is talking about carrion. Okay. लेकिन if the examiner is talking about crusting, so if there is thick crust over scalp, then it is favus. अगर scalp पर क्या दिख रहा है? If you can see black dots, अगर आपको ऐसा लग रहा है कि छोटे छोटे black dots हैं, then it is probably black dot type. And if you find a grayish patch with scaling, then it is grey patch type. So very precisely, अगर एक word से आपको याद रखना है, if you want to remember with one word, you can remember that if swelling is mentioned, it is carrion. If crusting is mentioned, it is favus. If black dot is mentioned, it is black dot type. And if scaling or grayish patch is mentioned, then it is grey patch type. Okay. Now there are different species which cause inflammatory or non-inflammatory, and there are various species which are commonly causing favus, carrion, black dot and grey patch types. So I would request sir to go to this portion and discuss the organisms and how to identify them.
Then what is selling sir spec suits you. Thank you. So if we talk about the carrion, so you know that this particular carrion is done by trichophyton, and this is the species which does it the most, trichophyton mentigrophytes. Okay, and another one is trichophyton verrucosum. Okay, so mentigrophytes and verrucosum, these are the important ones which does this inflammatory swelling, which rightly said by the sir, having a boggy stuff. Okay. And so recently the question also came with that the pets are there in the home, so it's a zoophilic type of stuff.
Yes. So if there are pets, actually आपने पढ़ा भी होगा, there are three types: anthropophilic, zoophilic, zoophilic. So if there is transmission from human to human, we call it anthropophilic. If there is transmission from soil to human, then it is geophilic. And if it is from animal to human, it is zoophilic. Zoo.
Right. So from that only, sir, I have made a mnemonic also for the students to remember, which I tell in my live class. And here also I like to tell you all, because they are important and they are being asked again and again. So you should also know. So by this carrion, you can remember the Cariminati. Everybody knows Cariminati.
Okay, so famous YouTuber.
And that particular fellow always does what? Any sort of mental activities. He throws something, he throws abusive words, all lots of mental activity he does. So mentigro, mental. Okay, and in this, important to know here itself, this was an INCT question last, that in the mentigrophytes, there is a test which is termed as hair perforation test, which we'll tell later how it is done. But hair perforation test is found to be positive in the case of mentigrophytes. So remember, in this particular sense, that Cariminati is there doing a mental activities and pulling his hairs, perforating his hairs, and thinking that he is doing a very veertavali activity. Okay, veer, to verrucosum. Fine. And when he do all these mental stuffs, where should these types of fellows, they should be kept in the zoo, and there should be paid service for them to see that they are zoophilic stuff. Okay, so by this, at least this upset association helps in the exam. Okay, and you could able to recall up the things by that particular one. So now I suppose you will able to remember up the mentigrophytes and verrucosum, the important ones which does this carrion. And this particular test, hair perforation test, which we'll discuss later, is found to be positive in the case of mentigrophytes. And here itself in the INCT they can add upon one more thing, that this particular organism is urease test positive also. Okay, urease test, we know the H. pylori, na, urease test. Here also urease test is there, but obviously these are fungus, so they take time to make this positive urease test. Color change again, yellow to pink, but this takes around 5 days to change up. Okay, so these all are important ones regarding the causative organism Chirion. Regarding the Favus, if somebody asks you regarding the Favus, important is Trichophyton Seanlini. This organism is being frequently asked. Manish sir will also agree up. This question have come number of times.
Yes.
Okay. That Favus is done by what? Favus is done by this Trichophyton Seanlini. And I have made a mnemonic for this also to remember. Favorite shoes lane. Okay. Favorite shoes lane hai, because it is being asked so many times. So you should also know up कि तुम्हें क्या लाने हैं? Favorite shoes. Fine. And this particular one is having this particular stuff, which sir will tell by the pronunciation. What you call it, sir?
So, see, I told you that if you find crusting, that is seen in favors. Okay, so favors presents with thick crusting over scalp, and this crusting is given a name. इसको हम बोलते हैं scutula. So scutula is a thick crusting which is seen in cases of favors. Now remember that this is not very common, but this is very commonly seen in residents of Kashmir. So if you find that if a question comes, अगर आपके एग्जाम में क्वेश्चन आता है उसमें लिखा है a Kashmiri individual presents with crusting over scalp which is very thick and foul smelling, then you should think of favors. And the most common organism, as the sirs told you, is Sholini. तो कौन से लाने हैं shoes, sir?
Favorite shoes लाने.
Okay.
Favorite shoes अपने लाने हैं. So that is Favus is done by this Trichophyton Seanlini. Ab from this side you can see up these macroconidias and all. So how they can integrate up in the INCT exam and all, because before only we tell that this integration happens and it happens in the exam. Most of the times I see that type of thing. Okay. So that you know that this is termed as what? Pencil shaped or cylindrical. That is observed in which particular ones? Trichophyton. So the Trichophyton is having pencil or cylindrical shape of macroconidia, and this is regarding the microsporum, and the microsporum is having a spindle shape of macroconidia, and this particular club shape or boat shape, and this is seen in epidermophyton. Okay, this is seen in epidermophyton, and this particular is club shaped or boat shape, we call it. So what they can do, guys, in this particular question, they can give up an image of Chirion, this which we have just shown up, and then they can relate up with this image, and they can ask up, name the organism. Okay, so obviously Trichophyton mentigrophytes, the Trichophyton, most of them they have what?
Pencil.
This pencil or cylindrical shape of macroconidia. Okay, so macroconidia means big spore and microconidia means small spores. So the Trichophyton are having what? Numerous microconidia, small spores, and they're having this pencil or cylindrical shape stuff. And likely wise, they can ask up questions regarding this, that microsporum one, epidermophyton ones, okay, like sir, Tinea pedis, Tinea crurus, they are being done by epidermophyton flocosum. So they can show that picture and they can relate with this. So like that they can do. And the same goes for your black dot, and which will show up in the images and all later. So that will also can be asked up with that. So they can give up this spindle shaped stuff and they can ask up which organism, Microsporum canis, gypsum, like that type of things.
Yes. So till now, majority of the question have been either they give you a clinical image and they ask you that what is the drug of choice or what is the investigation or what is the diagnosis. But next time they might ask you that this is the clinical presentation and this was the shape which was seen and what can be the causative organism. So it is important to remember these shapes, whether it is spindle shaped or whether it is cylindrical, and you can come to the answer, because next time they might integrate these two and they ask you in such a way.
Right. So you can tell more about dermatophytes, and we can discuss this question also. Recently asked question.
Yes, so this was one recently asked question, and now I think you can very easily answer this question because we have already discussed this. So what is being asked here? A 6-year-old child. So as I told you, this is very common in children. So question में क्या लिखा है? एक बच्चा, और बच्चा कैसे present कर रहा है? This child is presenting with painful boggy swelling, but you are very lucky because all the options are of fungus. So bacterial abscess is not coming to your mind despite the pain is mentioned. Okay, so sometimes they give options as bacterial infection, but this is obviously a fungal infection, which is very obvious from the option itself. So this is fungal infection. This is which fungal infection? I told you, if swelling is present in a child, you should think of tinea capitis. You should think of tinea capitis. Now coming again to the next point, that is on speaking to the parents on taking the history, you found that there were several pets in the household. Now what is the significance of writing this line? What examiners wants to think about? So examiner want you to know that there are pets, and I told you there are different dermatophytes, some transfer from human to human, some from animal to human. So they want to tell you that this is a zoophilic, that is coming from animal to human and thus causing tinea capitis. So just now sir told you that which is the zoophilic. कैरी मैनियाटी एग्जाम्पल डू यू रिमेंबर कि कैरी मैनियाटी ऐसी हरकतें करता है यूट्यूब में कि लगता है पागल है, अपने बाल नोच लेगा, और उसको तो पागल खाने में, उसको पागल खाने में या फिर जू में रखना चाहिए, है ना. सो जूफिलिक, so that is mentagrophyte. So obviously answer here is mentagrophyte, and mentagrophyte is one of the common causative organism for which type? Carrion type, which presents with tender boggy swelling, which is the inflammatory type of tinea capitis. And if next time they ask you that which type of alopecia will be seen, then it will be scarring alopecia. That is a permanent type of alopecia.
This question is coming, sir.
Yes.
Scarring alopecia.
And they might ask you investigation. So which investigation to be done? 10% QH mount will be done. And if they ask you which will be the drug of choice, so multiple questions they ask you from the same history. Okay, so they might give you history, next time they might ask you the drug of choice, or the next time they might ask you the type of alopecia. So drug of choice is oral griseofulvin. Now very important point to remember about griseofulvin, that griseofulvin is not effective in candidiasis, which is again a fungal infection. Griseofulvin is not effective in pityriasis versicolor, which is also a fungal infection. So remember that griseofulvin is not very effective in such superficial fungal infections like candidiasis and versicolor, but it is very effective in tinea capitis, and that's why it is here drug of choice. And that's why this is the choice of question for the examiner also. They want to ask you something which is very peculiar. So this is a very peculiar drug which is a drug of choice for tinea capitis, and trichophyton mentagrophyte will become the answer.
Answer of choice. Sir, tell something about these fellows also. Microsporum odini in canis.
Okay, so like all of you know that there is this is one mnemonic which I tell in in my class also, that there are three dermatophytes, है ना? Trichophyton, all of you know, epidermophyton and microsporum. Okay, so they all can involve skin, hair and nails, except nails are never involved by microsporum, while hair follicles are never involved by epidermophyton, isn't it? And if you forget this in examination hall, it is very easy to recall that M
do not involve N
के पास क्या आता है? N, है ना? जैसे आपके मम्मी पापा हैं, आपके भाई बहन हैं, एंड आप कभी भी नहीं चाहते कि उनका कुछ बुरा हो, है ना? सो वी नेवर ट्राई टू एडवर्सली अफेक्ट anyone who is near to us, who is dear to us, है ना? So you just have to find out which is the near and dear one of M. M के पास N, तो ये इसको कभी इन्वॉल्व नहीं करेगा. E के पास, so who is the near and dear one of E? H, so it won't involve hair follicles. And trichophyton में क्या आता है? Tri means all three, so it is going to involve all three. So if you see the first option, E do not involve H. और हम बात किसकी कर रहे हैं? टीनिया कैपिटिस मींस स्कैल्प इन्वॉल्वमेंट. स्कैल्प इज फुल ऑफ हेयर फॉलिकल्स, तो हेयर फॉलिकल्स को कभी इन्वॉल्व नहीं करेगा कौन? एपिडर्मोफाइटॉन. सो दिस गोज आउट ऑफ द क्वेश्चन बिकॉज इट नेवर इन्वॉल्व्स हेयर फॉलिकल. Okay, then there are other species of microsporum as well which can cause different types of tinea, like
उधर थोड़ा.
So just now I told you there are different types of tinea capitis. So tinea capitis, I told you there are four types. Carrion, like carrion is commonly caused by trichophyton mentagrophyte. Just now sir discussed. This is also caused by trichophyton verrucosum. There are other causative organisms also, sir will discuss those, but at least important one you can remember. Similarly, there is a type which is known as favus. Favus also sir told you, Sholini. Then black dot type, Black dot type is
So let
common.
me ask a question to them. So this Curion and Favus inflammatory or non-inflammatory? Can you tell guys in the comment section? Inflammatory or non-inflammatory? Sir, I've just told you this. Curion and Favus, what they are? They're inflammatory form or non-inflammatory one?
Yes,
This question
please
is
type,
coming.
type
Please
in the
type up in the comment section.
Similarly, black dot is commonly caused by trichophyton violatium and trichophyton tonsurens, while grey patch is commonly caused by Microsporum canis. So these are few common causative organisms which can be asked if they ask you the specific type. So
Very good. Everybody is telling inflammatory, sir. Good.
yes, so very good. So yes, both these are inflammatory and both these are non-inflammatory type. So I would request sir to discuss a few more dermatophytes because this is something which is very important, and what are other important points related to them.
Sir, that thing, na, actothrix and endothrix.
Yes.
We can tell this question we can discuss, sir.
Uh-huh.
So you.
So this is next question which is on tinea capitis. Just now I told you that tinea capitis can be of multiple types, and if you read this question, in this question itself it is mentioned that easily pluckable hair follicles. So I told you whenever they are easily pluckable, they are fungal infection. So easily pluckable hair follicles and black dots. आपको question में ही answer बता दिया, black dots दिख रहे हैं. So black dots, if you closely see, you can see various black dots which are present. So black dot type of tinea capitis this is. Okay, so this time again the diagnosis becomes tinea capitis. Which type of tinea capitis? Black dot type. Black dot which is non-inflammatory type. And I told you that whether it is inflammatory or non-inflammatory, for all tinea capitis, the drug of choice is same, and that is griseofulvin.
Now it should be remembered by everybody.
So answer becomes griseofulvin. Okay. Now griseofulvin is the drug of choice for tinea capitis, and as I told you that these are different types, let us see the images also. So if you see the images, you will find that if swelling is present, okay, so if swelling is present, like here, tender boggy swelling over scalp, then this is carrion. Okay, so clinically
Another
you
presentation.
can, yes, so you can clinically very easily identify, and as you can see that there is hair loss also. So many a times patient comb करता है, बाल काटता है, या कई बार pull होते हैं hair follicles and they easily come out. So you will find a patch of hair loss also. But here you can see lot of crusting is present, and I told you whenever you see crusting, it is suggestive of favus. So this is a favus type which is common in residents of Kashmir. So remember, generally this language will be written in the question, that a Kashmiri individual presenting with thick foul smelling crusting over scalp. While if in the patch, if you closely see what you can see here, there are black dots which are present. So black dots are present. So this is black dot type. So this is black dot type of tinea capitis. While here you can see that there is scaling present, and this patch is slightly grayish in color in comparison to the remaining scalp because of the scaling. So this is known as gray patch type. Gray patch. If you remember, just now I told you that black dot is commonly caused by Trichophyton violatium and Trichophyton tonsurens. Both these are endothrix species. Endothrix. Endo का मतलब अंदर. अब ये एंडोथ्रिक है, ठीक है, तो मान लीजिए ये हेयर फॉलिकल है. सो लेट अस कंसिडर दैट दिस इज द हेयर फॉलिकल. ओके, and all the fungal spores are where? Inside the hair follicle or outside the hair follicle?
Inside.
They are endo, so they are inside. So all the hair follicles are inside. Okay, so whenever something intrudes inside, what happens? This hair follicle becomes very weak and it starts breaking, and when it breaks just at the level of skin. तो यहां से बाल टूटते हैं एकदम स्किन के पास से. तो मान लीजिए ये पेशेंट का स्कैल्प है, यहां पर ये पैच है. सो दिस इज द पैच ऑफ हेयर लॉस, एंड दिस पैच विल बी स्टडेड विद ब्लैक डॉट्स, क्योंकि यहां पर सारे बाल टूट गए हैं. कहां से? एकदम स्किन के सरफेस से. तो आपको ब्लैक डॉट्स दिखेंगे. सो मेनी टाइम्स एग्जामिनर आस्क यू दिस क्वेश्चन ऑल्सो, दैट दीज ब्लैक डॉट्स विच आर सीन इन ब्लैक डॉट टाइप, दीज आर व्हाट? दीज आर फंगल कॉलोनीज ऑफ ब्लैक फंगस. No, these are not fungal colonies. These are what? These are broken hair follicles. वही टूटे yes, वही दिख रहे हैं. ठीक है, लेकिन कई बार क्या होता है कि एक्टोथ्रिक्स स्पीशीज इन्फेक्शन करती है. जैसे कि जस्ट नाउ आई टोल्ड यू, ग्रे पैच इज कॉमनली कॉज्ड बाय माइक्रोस्पोरम कैनिस. नाउ माइक्रोस्पोरम कैनिस इज एक्टोथ्रिक्स. नाउ बिकॉज दिस इज एक्टोथ्रिक्स, द स्पोर्स आर आउटसाइड द हेयर फॉलिकल. तो मान लीजिए ये हेयर फॉलिकल है. So if this is the hair follicle, all the spores are outside. So they are making the hair follicle weak from the outside. So this hair follicle do not break just at the level of scalp, it breaks somewhere here. So you will find a patch with broken hair follicles, and due to this fungal infection there is a lot of scaling which is seen, and due to which this grayish patch is seen. So if you find a gray patch, it is suggestive of ectothrix, that is Microsporum canis, and if you find black dots, it is probably endothrix like Violatium and Tonsurens.
And here only I like to tell you regarding this also, this hair perforation test, and this might be there in the INCT of yours. So basically guys, as you can see up, the trichophyton mentigrophytes, the hair perforation test is coming positive in this particular one. So basically how we do this particular test. So what you can do that sir gives a plugged hair, and you can put that directly into moist conditions, and after 4 to 5 days when you see that hair under microscope, you can observe up certain wedge shaped perforations, and this is termed as wedge shaped test or perforation hair perforation test positive. So this is observed in whom? Mentigrophytes. If you remember that hair perforation, the Cariminati stuff. Okay, so this is positive in this, and along with that, this particular test, which might come a new one, Microsporum canis. This also shows up hair perforation test positive. Okay, this also shows up hair perforation test positive. And here I like to tell you one thing, and sir will also agree up, that most of the infections in the tinea which are there, they are done by these two fellows. One is mentigrophytes and one is rubrum. Okay, so they are very common. So how to differentiate between them? This is one of the important tests to differentiate between them. Mentigrophytes is positive for this, and rubrum is negative for this. Hair perforation test negative is rubrum, and hair perforation is positive in whom? That is in the mentigrophytes. Another important question which have recently come is that rubrum is having a red color pigment. Okay, this is having red color pigment on the culture, and this red color pigment means if you grow up in the SDA and all, so they produce this type of a pigment. And how you can remember that? By this rub. So rubbing karne se red ho gaya. So rubrum is having this red color stuff, and it have already come in INCT like this, and they can arrange it with the clinical features and all, and they can ask up. So mentigrophytes and canis, they are hair perforation test positive. Rubrum is hair perforation test negative, and this particular one is also having what? Red color pigment. Okay, so this is what is the importance of hair perforation test, and it can come in the exam. Another important test is, which I have already told you, urease test. Okay, urease test is positive in what? Mentigrophytes, and it is negative in whom? Rubrum. So basically two tests to differentiate between them. One is mentigrophytes and one is rubrum. Okay, and sir, I just like to tell up, when you send up those hairs, nail clippings, okay, so what we do actually with them is, first of all, you put in 10% KOH. What we likely to see in that? Fungal elements. Okay, we just write up a principal report, fungal elements seen. So you can start a fungal treatment, whatever this. But if you want that, which species? Is it Trichophyton, Microsporum, Epidermophyton? Yes. Then we have to do what? Culture. Okay. And culture is being done on what? SDA. Okay, because fungus, universal culture media is this SDA. Yes. Say broad dextrose agar. And some DIM medias also come. Dermatophyte identification medias, DIM. Okay. We call them as DIM. So on that, the colonies, they come 3 to 4 days. Okay, after that, you take that growth, you do a LPCB mount. LPCB is lactophenol cotton blue. Okay, and when you observe them under microscope, you could able to see these all which have shown up, that cylindrical macroconidia and all that stuff. Okay, you can observe that, and by that you can able to identify that which species we are talking about. Trichophyton, Epidermophyton, Microsporum, what. So that is what is the logic of
which strain you said, sir?
LPCB, lactophenol cotton blue.
Blue. So it is blue in color.
Yeah.
So this answers this question also, because one student is asking that what is this blue color. So I think now this is clear. So sir have already explained. और मुझे जान के बहुत अच्छा लगा. This is very very informative for me also, क्योंकि हम लोगों का काम क्या होता है, whenever a fungal infection comes to us, what we do, we take the, if it is a skin infection, so we take a skin scraping, or if it is like tinea capitis, we take the hair follicles and we send it to lab, and then our work is done, and then sir का work शुरू हो जाता है. So now we came to know कि भाई आपकी lab में फिर क्या क्या होता है. So that is very interesting.
And they can correlate also, sir. Like this only they will correlate in the exam, and already they have done 2 questions have come on hair perforation test. So next might be urease. So all this might be coming in integrated fashion for sure in the exam. So that's why we're discussing this in long way. Okay, so let's go to more topics, sir.
सो टीनिया कैपिटस बहुत इंपॉर्टेंट था, सो मेनी टाइम्स क्वेश्चन हैव बीन आस्क्ड, अभी रिसेंटली परफोरेशन टेस्ट के ऊपर आया, देन टीनिया कैपिटस कैरियन के ऊपर आया, तो इसलिए हमने इसको थोड़ा ब्रॉडली डिस्कस कर लिया. नाउ लेट अस मूव ऑन टू द नेक्स्ट कंडीशन. सो अगेन आई एम गोइंग टू शो यू दिस इमेज एंड यू हैव टू आइडेंटिफाई दिस कंडीशन. व्हाट आर द इंपॉर्टेंट थिंग्स व्हिच यू कैन सी इन दिस इमेज. देखिए कई बार क्या होता है एग्जाम में इमेज आती है और आप लोग घबरा जाते हैं कि पता नहीं क्या है इस इमेज में, बट व्हाट इज मोस्ट इंपॉर्टेंट इज दैट यू शुड लुक फॉर द मोस्ट ऑब्वियस थिंग इन द इमेज. तो इमेज में आपको क्या देखना है जो कि सबसे ऑब्वियस है, जो आपको देखते ही पता चल रहा है. तो जैसे ही आपने इस इमेज को देखा तो आपको देखते ही क्या पता चल रहा है. ओके, सो एज सून एज यू सी दिस इमेज, व्हाट यू कैन सी infant. I hope everybody can see infant, है ना? So there is one infant. Okay. Now you can see few red lesions. Where? Over the neck. So there is this red lesion which you can see, and it is present over the neck. Now not just neck, but the neck folds are also involved. So you can see neck folds are also involved. So neck folds are involved. And around this lesion, एक बड़ा सा lesion है, and around this large lesion, there are few smaller lesions also. So you can see few smaller lesions around it. What are these? Yes. Can you tell me in the comment box? What are these? These are, excuse me. These are satellite lesions. Very important. Very, very important. So many times question have been asked. Satellite lesions are seen in. So satellite lesions are seen in, and I always tell my students that at least remember these three conditions where satellite lesions are seen, and that is, तो मान लेते हैं आपके पास एक छोटा सा बच्चा आता है, ठीक है. सो लेट अस कंसिडर दैट यू आर सिटिंग एंड अ स्मॉल चाइल्ड कम्स टू यू एंड ही सेज कि डॉक्टर साहब मुझे बड़े होके साइंटिस्ट बनना है और मुझे सैटेलाइट्स लॉन्च करना है. तो आप क्या बोलेंगे कि आप क्या पढ़िए? व्हाट यू विल टेल हिम टू डू? So obviously you will ask him to study science, isn't it? So satellite lesions are seen in BSc. तो भाई satellite launch करनी है तो science पढ़ लो. Okay, so BSc satellite you can very easily remember. So B for BT type of Hansen's disease, that is leprosy. S for sporotrichosis, and C for candidiasis. Candidiasis. Now candidiasis is one condition which commonly involves flexural areas, that is folds, which are involved here. Folds like neck folds, axilla, web spaces, inframammary folds, or genitocrural fold, intergluteal folds. So folds are involved in candidiasis, and that type of candidiasis is known as candidal intertrigo. So this is a case of candidal intertrigo. Okay, so this is how you need to approach to these images. So what you can see कि एक छोटा सा बच्चा है, infant है, and infants they are chubby and they have short neck, so they have quite prominent neck folds, and the infection of neck folds due to candidiasis is known as candidal intertrigo, and that's why these satellite lesions are seen here. Okay, so this is a case of candidal intertrigo where satellite lesions are seen. Now candidiasis is important, and the common causative organism is, sir will tell you.
सर कुछ जिंक डेफिशिएंसी से भी कंफ्यूज कर रहे हैं उसको.
अच्छा, so see, yes, zinc deficiency causes acrodermatitis enteropathica. ठीक है, तो एक कंडीशन होती है, कई बार थोड़ा सा बड़ा नाम है तो स्टूडेंट्स कंफ्यूज हो जाते हैं. सो रिमेंबर acrodermatitis enteropathica. Now this is a condition which is due to zinc deficiency. Okay, now the features of this conditions are very easy to remember, because if you just know the name of the disease you can remember the features. ठीक है, तो features याद रखना बहुत ही आसान है, बस आपको इसका नाम याद रखना है, और नाम तो क्वेश्चन में ही लिखा होता है तो वो तो याद रहने ही वाला है. ठीक है, सो acro word कहां से आया है? So this acro words comes from acral, and acral means acral parts like hand and feet. Okay, so इसमें किसका इन्वॉल्वमेंट होता है? hand and feet का इन्वॉल्वमेंट होता है. ठीक है, now other than acral part there can be involvement of face and groin, but generally around lips or mouth. So perioral area and perianal area. इसीलिए कई बार एग्जाम में लिख देते हैं डाइपर एरिया. So in infants,
Canada में भी तो
yes, so there also diaper rashes are seen, but here remember that this is generally perianal. Okay, and not just perianal, because candidiasis is only restricted to the folds, but here hand can get involved, feet can get involved, perioral area can get involved, not necessarily folds. Okay, Now remember, derma means skin and itis means inflammation, and whenever there is inflammation, there is a redness. So here they become red, inflamed, okay, and there might be scaling also. And entropathica, where entro words come from, entro, it is related to intestine. So here there is diarrhea. Okay, and because there is zinc deficiency, and zinc is one important mineral which helps in hair growth. Okay, so these patients can suffer from alopecia also. Now this alopecia is non-scarring type of alopecia. So if in the exam question comes that a child, because this is a zinc deficiency, this is a genetic condition, so this also present in children, but here you will find few more options, like in the question diarrhea will be mentioned or alopecia will be mentioned, not just diaper areas but other areas like perioral area, acral, that is hand and feet involvement is seen. So if such type of clinical history is mentioned, then you should think of acrodermatitis entropathica. And the most important point, satellite lesions are never seen here, but they are seen here.
सैटेलाइट के लिए तो बीएससी करनी पड़ेगी सर.
Yes. सैटेलाइट लॉन्च करना है तो साइंस
पढ़नी
पढ़ो.
पड़ेगी, उसके बैचलर बनना पड़ेगा. ठीक है सर. ये
So these are other images of candidal intertrigo. Like I told you that this involves flexural areas like folds. So these are various folds which can be involved, like diaper areas, that is, this is genitochleural fold. Here inframammary folds can get involved. Here web spaces can get involved. Here again you can see inframammary folds are involved. So candidiasis or any other fungal infection requires a humid environment, and folds are generally touching with each other. So there is rubbing, friction, there is breach in the skin, as well as there is more sweating which accumulate there, so more humidity, and that's why the candidiasis begins here, that is in the folds. And another predisposing factor is that patient is generally having history of diabetes, because raised blood sugar level also predisposes for candidal इन्फेक्शन. तो अगर इनमें से कोई पॉइंट भी क्वेश्चन में लिखा है कि एग्जाम द infection is present in the fold or the patient was suffering from diabetes, then you should think of candidiasis before any other condition.
I suppose this is clear now. Okay, so how you can correlate up with the micro, this statical stuff. So candida, as you know, it's a fungus and it's a yeast-like. Okay, so what's the meaning of this yeast-like stuff? Yeast-like is that it can be in the form of true yeast. Okay, yeast means what? Any oval shaped structure is termed as yeast. Fine. And along with that, it can be in the form of pseudo hyphae. Okay, and pseudo hyphae is actually just as swelling types, and true hyphae also they can be observed in this. So this particular candida, in fact I should write candida albicans. This particular species is such which can show you any form. It can be a yeast, it can be pseudo hyphae, it can be true hyphae. Okay, pseudo hyphae basically means budding. Okay, budding, if you see in the yeast cell, like this budding, so that particular term as pseudo hyphae. So those particular candida species which shows the pseudo hyphae, in fact most common is candida albicans, they are invasive in nature. Okay, so they are invasive in nature and they secrete up this particular enzyme termed as phospholipase, and that's the logic of this infection causing of them. Okay, so they are invasive in nature and they release of this particular enzyme that is termed as phospholipase, and this change of the forms yeast, pseudo hyphae, true hyphae, it is termed as phenotypic switching. Okay, it is termed as phenotypic switching. So these might be there in the INCT exam, that which particular enzyme is secreted by this candida albicans and which phenomena is seen in that. So that is termed as phenotypic switching. And as the Zen mode is telling in the comment section, that the last NEET PG question was that which particular agar is used to differentiate the various species of candida. The answer is chrome agar. So this is actually a colorful agar, and what happens in this, that the sample is there, you just put up on this chrome agar and the particular color comes of that colony. Okay. And in the leaflet only that color is given, that if this white color, albicans, okay, if this pink color, glabrata, if this color, cruzi. So like that, it's very easy to differentiate between them, and this was there in the NEET PG, that how to differentiate between the candida species nowadays. Simply, it is done with the help of chrome agar. Okay.
And I think this is very important because there are different species, like some they respond to azoles, exactly, some they don't respond to azoles.
So we should know that.
So at least we can do this chrome agar and we can know that which species is causing it.
True. And for that only, I should tell you that these two are there. One is cruzi and one is Candida glabrata. These are intrinsically resistant to the azoles. Okay. Otherwise, as you know, sir also will be telling of that drug of choice for the Candida is mostly fluconazole.
Yes.
Okay. But cruzi and glabrata are such which are अंदर से ही कमीन है. ठीक है. Cruzi and glabrata, they are intrinsically resistant to what? Azoles. Right. So we can use what, sir, then?
So see, generally if candidiasis is asked, and commonly it is caused by Candida albicans and it is very sensitive to fluconazole. So that's why the drug of choice for candidiasis is fluconazole. Okay, so that is a very important question, and all of us know that in candidiasis we generally give fluconazole. But if you did a chrome agar and you came out with the the species is something like glabrata or cruzi, then we cannot give azoles because these are resistance to azole. So then we use echinocandins. Okay, so these antifungal agents can be used in the treatment of such species.
And students, one question is coming in every exam, and that you should also know that which particular test we do for invasive candidiasis. And invasive candidiasis is tested with this test nowadays in the higher centers, beta-1,3 glucan testing. And this beta-1,3 glucan testing is done for Candida, it is done for aspergillosis, and it is done for pneumocystis cerevisiae. Okay, this mnemonic cap helps you to remember a lot of things, and it is coming in every exam. Since 2 years I am seeing up, this have become favorite. I think this company is sponsoring up the question. Beta-1,3 glucan testing is done for what? Important. Important is it should be invasive. Okay, invasive candidiasis, invasive aspergillosis, and this pneumocystis cerevisiae, which is common in HIV positive ones, does the pneumonia and all. Okay, at CD4 count of less than 200. So these are the 3 infections in which we do this beta-1,3 glucan testing commonly. And important to know here itself, that was asked, that you do not do this testing in zygomycosis. Mucormycosis, you don't do this. In cryptococcus, you don't do this. And this is also being asked, that they are not done. They are not done in what? In the zygomycetes family members and into the cryptococcus stuff. Right? So this is also to be remembered of. And Candida is important because it's a common infection, HIV positive also. Neutropenic individuals, they develop this. And in fact, there is a like ailment termed as CMC, that is chronic mucocutaneous candidiasis, which happens to be in T cell deficient fellows. So that is also to be remembered. And a lot of others important things are there. Chrome agar is already being asked. This is frequently being asked. So it is an important one. And they can easily correlate with this particular picture and all, and they can ask up. And even, sir, Candida can do meningitis also, like cryptococcus. This can also do meningitis, and that is invasive type. So obviously, which testing you will do? Beta-1,3 glucan test. So like that, they can interchange a lot of things, and they can ask up regarding the Candida. Let's move to the next one.
So very obvious from the name itself, it is written here, rose gardener came to you. So a forest worker or a rose gardener came to you. So obviously they are talking about which disease? Yes, they are talking about rose gardener's disease. Okay, so rose gardener's disease, and he got a thorn prick. Okay, so what happens that wherever there is thorn prick, so there is inoculation of the fungus in the skin, and there a nodule start developing. Okay, now what happens that this causative organism, that is this causative organism, spreads via lymphatics. So because it is spreading via lymphatics, what happens? It enters into lymphatics, then it produces another nodule, then another nodule, then another nodule, and all these nodules are present in linear fashion along the lymphatics. And that is what you can see in the image कि patient को क्या हुआ? Thorn prick हुआ, and after that a nodule developed, then another nodule, then another, and these linear row of nodules start developing, and such linear row of nodules are seen in sporotrichosis, which is also known as rose gardener's disease. Now remember that sporotrichosis can be of multiple types, but here we are discussing the most common type, which is the cutaneous type or the lymphatic type.
There is lymphocutaneous
yes, yes, yes. So there is one pure cutaneous. Pure cutaneous means there is only skin involvement, there is a single nodule developed, but there is lymphocutaneous or lymphatic type. Lymphatic type is the most common type, which is being shown here, where along with the skin, the lymphatic system also get involved, and there is one systemic type also. In systemic type, what happens that there can be inhalation of the agent which is causing the lung involvement. So here lung involvement is seen. So these are three different types, but the most common type is lymphatic, which is being shown here, and this is a case of sporotrichosis. Now you might ask that why this is not insect bite, why it is not scabies. So remember, we know that the most common site for scabies is flexural areas like web spaces. Here burrows are seen, burrows are most characteristic. Such linear nodules are not seen, so this is not scabies. Then mycetoma, all of you know that mycetoma is also known as Madura foot. So the most common site here is foot, which is not being shown here, and there multiple swellings are present. And this is not insect bite. Why? Because there is one condition known as insect bite hypersensitivity. So IBH, which is also known as papular urticaria. So this is another name of IBH, that is insect bite hypersensitivity, also known as papular urticaria. So what happens that wherever insect bites, there is the first lesion, but due to hypersensitivity, multiple lesions start developing. So there also multiple lesions are seen which can be very itchy. So here itching is always present. So itching is a very important clue. And second, this will not necessarily occur in linear fashion like sporotrichosis. So that's it. That is why this is not insect bite hypersensitivity. Though insect bite hypersensitivity is very itchy, and it can occur over exposed areas, because insects generally bite over exposed areas. So they can occur over hand and leg and face exposed areas. So that's why it is
eye
not.
for eye.
Yes.
It is itching. Huh?
So itching is generally present. Okay, so that's why this is a case of sporotrichosis, and all of you know the most common causative organism for sporotrichosis is sporothrix, and sir will give you more knowledge about that organism and the investigations which can be done.
So guys, this is also one of the questions sir will also agree up, which is coming again and again in the various fashions, like these linear nodules, which already sir have told up. The organism for this is a dimorphic fungus, which you know, and that is Sporothrix kinki. Fine. So this particular one is the organism, and it's a dimorphic fungus. It is which type of fungus? It's a dimorphic fungus, and important to know here is that mostly dimorphic fungus, they does what? Systemic diseases. But this is the exception, and it does subcutaneous mycosis. And this is also being asked that which is the dimorphic fungus which mainly does subcutaneous mycosis. The answer is Sporothrix kinki. Fine. And also termed as Rose Gardner's disease, sporotrichosis. Fine. Besides this, another important thing is anything which is dimorphic. Why it is termed as dimorphic? Because it exists in two forms. One is mold form and one is yeast form. Okay. Yeast is body temperature. Okay. It is at 37 degree, and mold is gold. And how much carat gold? 25 carat gold. So remember like this, mold is gold, 25 carat gold. It is at this temperature in the form of mold, and yeast is at how much? 37. Fine. So this particular yeast form, how does it look like of this? So in this you have narrow based budding yeast cells. Okay, you have narrow based budding yeast cells in this particular one, also termed as cigar shaped yeast cells. Okay, also termed as cigar shaped yeast cells. And as the mold form is concerned, flower like sporulation is observed. Okay, flower like, beautiful flower like sporulation is observed in the mold form. So that's why it is termed as what? Dimorphic fungus. But important is, does what? Subcutaneous mycosis, not the deep one. This is an exception. Right. Besides that, what else you can remember of? We can discuss of, sir. Have you seen a case of it? Sporotrichosis?
Sporotrichosis, as sir told you, that this is a subcutaneous mycosis, and this is very, very rare. And in my practicing career of 10 years, I have just seen one case of sporotrichosis.
Okay.
एक case हमारे पास आया था. She was a female, middle-aged female, 45 years, and she was having one lesion, 2-3 lesions in fact over the leg. तो पैरों में 3-4 निशान थे, और क्योंकि बहुत ज़्यादा नहीं थे तो एकदम linear pattern नहीं बन रहा था, but there were 3 in a row, and they were present over leg, and they were not healing, and they are not responding to any treatment. Like initially we thought ke infection hoga, so we gave antibiotics, but it was not responding. So finally we did then biopsy. And
सर कुछ हिस्ट्री पूछी थी क्या? कहाँ से थी?
She was from Uttarakhand.
Uttarakhand. So that's what I tell in classes also. It's common in hilly areas. Okay. So there the thorn prick happens, and then this disease happens. So that relates up. Uttarakhand. Okay. And you have sent it for the biopsy. in that biopsy only, guys, there is a phenomena which is termed as splendor Hopili phenomena. This is observed, and this diagnose other things, and this can come in the INCT exam. Centrally basophilic and around that eosinophilic material is seen in this, and that is what is termed as splendor Hopili phenomena. Okay, also termed as asteroid bodies. There's some like told up in the comment section.
Yes.
So this is what is asteroid bodies. Okay, so this is also important. And sir, what is the treatment of it? Like,
treatment for this like lymphatic variant, which is the most common variant, we treat it with itraconazole antifungal, which is effective in this condition. But there is one more agent. I don't know how many of you know about that agent that can be used in sporotrichosis. It is very effective. It is still used, but only problem is that it can lead to some thyroid related side effects. So can you just name in the chat box that which agent can also be used in sporotrichosis? So sporotrichosis, generally we give itraconazole, but there is one more agent which can be used, but we generally don't prefer it because it can lead to thyroid related side effects. So that's why we have to monitor the thyroid levels. So anyone, can you guess?
It will be tough for Sen. Zatvik is studying doxycycline.
Okay. Yes, so one student have answered it correctly.
Wonderful.
Yes,
Wonderful.
very
Dr.
nice.
Shubham.
Shubham. Yes, so Shubham Gupta have answered it correctly. Yes, it is potassium iodide. Long back this question also came, but recently no question have been asked on potassium iodide. So remember that potassium iodide is also very effective, and this is given in saturated solution. So in short we call it SSKI. So SSKI is saturated solution of potassium iodide, which is also effective in sporotrichosis. I tell in my classes also SSKI. तो मान लीजिए ये बॉटल है और ये बॉटल SSKI से भरी हुई है, तो मान लीजिए ये बॉटल में SSKI है और ये मैंने आपके सामने रख दिया, ठीक है। तो अब आप बताइए कि आप पेशेंट को क्या बोलेंगे कि इसको लगा लीजिए, इसको खा लीजिए, इसको इंजेक्ट कर लीजिए. सो हाउ, व्हाट इज द मोड ऑफ गिविंग दिस SSKI? सो आपके पास एक सॉल्यूशन है SSKI का, मैंने आपको दे दिया, स्पोरोट्राइकोसिस का पेशेंट है, अब आप उसको क्या बोलेंगे? ये लीजिए, लगा लीजिए. यस, टाइप in the comment box that what you want to tell the patient, what is the mode of giving SSKI. इसको लगाना है, that is topical, इसको खाना है oral, और इंजेक्ट करना है इंट्रालीजनल और इंट्रावीनस और IM whatever. So yes, can you guess or anybody knows? Shubham Gupta, would you like to type? क्या करेंगे SSKI को, क्या करेंगे? Yes, one more student mentioned SSKI. Rahul.
Lot of others.
Yes, so Rahul Sharma. Yes, Rocky भाई, बताओ भाई, रॉकी भाई.
यश.
So yes, so Jatvik is saying topical. So this is the obvious choice. Most of the people think के solution है saturated.
स्प्रे करा रहा है.
अच्छा, स्प्रे करेंगे. So remember that solution है, generally हमें लगता है solution है, cream है, lotion है, तो हम क्या करेंगे? लगा लेंगे. But remember that this is not topically applied. Okay, this is given orally. Okay, so remember that we give orally saturated solution of potassium iodide. Okay, so this is the mode of giving SSKI. So I hope this was interesting for all of you.
A different one, sir. Sir, your comments on this?
So yes, so this we have included in this session because this is a very recent question which was asked, and yes, so NEET PG में आया था और probably आपके एग्जाम में फिर से आ सकता है. तो इस क्वेश्चन को हम डिस्कस कर रहे हैं, और इसमें अगर आप देखें कि जब क्वेश्चन आया था उस क्वेश्चन में एक पॉइंट लिखा हुआ था कि पेशेंट इज सफरिंग फ्रॉम HIV infection. So patient is having immunocompromised. Yes, patient is immunocompromised, और immunocompromised patient में ये condition हो गई. ठीक है, अब जब भी हमारे दिमाग में immunocompromised condition आती है तो हमारे दिमाग में second चीज क्या आती है कि because patient's immune system is compromised, there are more chances of infection. Okay, so obviously इस patient को infection हुआ होगा. So infection, अब infection तो बहुत सारे होते हैं, कोई भी infection हो सकता है ये कोई bacterial infection हो, या फिर ये वायरल इन्फेक्शन हो, और इट कैन बी फंगल इन्फेक्शन. So there can be different types of infection which can occur in immunocompromised patient. They might present with bacterial, viral and fungal infections. But if you closely see this image, what you can see? Yes, you can see that there are few papillary lesions. So you can see these are few papillary lesions. They sometimes increase in size and become plaques also. But here in the image you can see they are solid, they are raised, and they are less than 0.5 centimeter in size. So such lesions are known as papules. So papules are present. And if you closely see these papules, what you can see in the center? In the center of the papule, you can see a depression. So all these lesions are having a central depression.
Umbilication.
Yes. So central depression, that is central umbilication. तो सेंट्रल अम्लाइकेशन इज प्रेजेंट। नाउ जैसे ही आप सेंट्रल अम्लाइकेशन सुनते हैं आपके दिमाग में कौन सी कंडीशन आती है? यस यस, मोलस्कम कंटेजियोसम। ओके, सो मोलस्कम कंटेजियोसम, लाइक आई टोल्ड यू, HIV पॉजिटिव पेशेंट है, इम्यूनो कॉम्प्रोमाइज पेशेंट है, इन्फेक्शन हो सकता है, इन्फेक्शन कोई भी हो सकता है, इट कैन बी वायरल इन्फेक्शन लाइक मोलस्कम कंटेजियोसम, इट कैन बी बैक्टीरियल, इट कैन बी fungal. Now remember that central amplification is present. So you should know that which are the conditions which can present with central amplification, that is a central depression. And I hope this is clear. क्या दिख रहा है? एक पैप्यूल है, एक solid raised area है. Solid क्यों बोल रहे हैं? क्योंकि इसके अंदर ना तो fluid है, ना तो इसके अंदर pus है. क्या है? Solid है. So solid है, raised है, छोटा है, less than 0.5 सेंटीमीटर है, इसलिए पैप्यूल है. और पैप्यूल के सेंटर में एक डिप्रेशन है ना? तो बिल्कुल ऐसा लगता है जैसे कि एक मोटे से सेठ जी हैं, उनका एक बड़ा सा पेट है और बीच में सभी के पेट में क्या होता है? एक अम्लाइकस होता है, एक डिप्रेशन होता है। तो वैसे ही है, एक पैप्यूल है और बीच में डिप्रेशन है, इसको बोलते हैं सेंट्रल अम्लिकेशन। और कॉमनली किस में मिलता है? वायरल इन्फेक्शन में मिलता है, जैसे कि मोलस्कम कंटेजियोसम। ठीक है, लेकिन कुछ फंगल कंडीशंस भी होती हैं जो कि इस तरीके से प्रेजेंट कर सकती हैं, जैसे कि इसमें लिखा हुआ है, सबने गेस भी कर लिया होगा, हिस्टोप्लाज्मोसिस। सो हिस्टोप्लाज्मोसिस, क्रिप्टोकोकोसिस, and there are few other viral conditions also which can present with amplification like orf virus infection, orf disease,
Pox virus.
yes, parapox. This
Pox
is caused,
will be
yes,
family
yes, it is caused by molluscum is pox, and this is orf, that is parapox, and it can be due to other viral conditions as well like Milker's nodules, cowpox. So there are various conditions which can present with umbilicated lesions, and here various fungal infection can also present. And when there is infection with bacteria, generally patient have septicemia, and when it is methicillin resistant staphylococcus aureus infection, then it can also present with this type of umbilicated lesions. So multiple infections can present with umbilicated lesions, and they can be seen in HIV positive patients. So how to differentiate? So remember that if you find that patient is having skin involvement, only skin involvement with central umbilication, then mark molluscum contagiosum, and patient is immunocompromised. Okay, so if immunocompromised patient like HIV patient, like it was mentioned in the question, presented with skin manifestation like shown here, if only this is mentioned, then you will mark molluscum contagiosum. But if in the same question where the patient is HIV positive, presented with skin lesions having central umbilication, along with that lung involvement is present, lung involvement is present. So lung involvement, if it is mentioned that patient is having hilar lymphadenopathy or pleural effusion is present, pneumonitis is present, or dyspnea or any lung finding is present, then you should think of systemic fungal infection, which is very common in immunocompromised HIV positive patient like histoplasmosis and cryptococcosis. Now remember that lung infection can occur in both, that is histoplasmosis as well as cryptococcosis. But then how to differentiate these two if both are there in the option? So remember that histoplasmosis generally present with lung involvement, but in cryptococcosis there can be CNS involvement as well, which is commonly in the form of meningitis or meningoencephalitis.
Most common.
Yes. So
HIV positive most common cause.
Yes. So you can now very easily differentiate these conditions. So if a question comes that patient was HIV positive, because we don't know the actual language of the question which came in the examination, so we have not included that question, but many students have given us feedback that there was HIV positive patient and there was umbilicated lesion. Now how to differentiate? So this is a differential diagnosis for such cases: HIV positive with skin lesions having umbilication, then molluscum contagiosum, but along with lung infection, then it can be histo as well as crypto. And if along with that meningitis or something CNS is mentioned, then crypto. Okay, so I hope this will be clear.
And to add to this, the micro part, I like to tell up that again, histoplasma, in fact, histoplasmosis is done by histoplasma capsulatum. Okay. Answer, I generally ask up that how much thick capsule the histoplasma capsulatum have. So guys, answer is there is no capsule. Okay, you must be knowing up also. So histoplasma capsulatum is not having capsule, just the name is there, that is capsulatum. And histoplasmosis is also termed as Darling's disease. Okay. Not that Darling. So Christian Darling is there.
Okay.
The scientist who discovered up, also termed as Cave's disease, and it is termed as a sort of a endemic mycosis, common in some areas of America, like Ohio, Arizona, and all that. Not Ohio, Oreo, Arizona, and all. So there it is common histoplasmosis, and it is done by this particular fungus, Histoplasma capsulatum. As Sir has told, primarily involves what? Lungs, because the spores are there, they inhaled up in immunocompromised fellows and lungs are involved. Second common is this cutaneous involvement, which have been asked in the exam like this. Okay. Another important thing which you can add to this is that how does, because I've just told you, if it is a dimorphic fungus, it will be having yeast, it will be having mold form. Okay. And the mold form of this is having a typical lesion termed as tuberculate macroconidia. Okay. So guys, you might find it in INCT exam. Tuberculate macroconidia is observed in. And what is tuberculate macroconidia? This looks like a sunflower. Okay. This looks like a sunflower like, and this is the macroconidia. Macro means big spore. Okay. The yeast form of it looks like the narrow based budding. Okay. Narrow based budding means what? That there is a like yeast cell and just a small protuberance. This is termed as narrow base budding, fine. And just now we have done somewhere else also narrow base budding, sir. So that is sporotrichosis. In that also narrow base budding is there, and in this also the narrow base budding is there. In both of them it is seen. Important to know is they have asked this question like 2-3 exams. They have shown up bone marrow biopsy in this, and in the bone marrow biopsy you can observe up these yeast cells, and this is important. Okay. So you might be having the question regarding histoplasmosis in the form of traveling. So traveler's history might be there in this, and they can ask us that if we have done this bone marrow biopsy to diagnose other things, and we could able to see something inside that. That something is what? Yeast cells. Okay, that something is yeast cells. As we know, which temperature yeast forms? 37. And mold is gold. Gold is how much carat? 25 carat. Fine. So tuberculate macroconidia is observed in this, and the narrow base budding is observed in this. Is it fine? So this is regarding the histoplasmosis, which you should know, also termed as Darling's disease. Okay.
तो सर डार्लिंग, जितनी भी डार्लिंग आपकी देख रही हैं ये वीडियो, उन लोगों को थोड़ा बच के रहना चाहिए, क्योंकि अभी अभी सर ने एक और डिजीज डिस्कस की थी, स्पोरोट्राइकोसिस, विच इज नोन एज रोज गार्डनर्स डिजीज. और ये जितनी भी डार्लिंग्स हैं, मतलब कि जितनी की भी गर्ल्स हैं, इनको रोज बड़े पसंद होते हैं, है ना. तो भाई लड़कों ध्यान रखो कि जब भी रोज दे रहे हो उसके थॉर्न तोड़ के दो, ठीक है. There should be no risk of sporotrichosis.
अब तुम्हें शायद याद रहे रोज गार्डनर डिजीज कौन सी है. फाइन. सो ये एब्सर्ड एसोसिएशन बनानी होती है, बिकॉज दिस ओनली कम्स इन द माइंड इन द एग्जाम, अदरवाइज सब साफ हो जाता है. ठीक है. So let's go to the next one.
अच्छा सर, एक और पॉइंट आप बता रहे थे कि इसमें कुछ ट्यूबरक्लोसिस से रिलेटेड क्या था?
हाँ, that was there, that chronic histoplasmosis mimics TB. Okay, so it comes in the DD of tuberculosis. So this particular one comes in the DD, and I suppose in the question this was also being given up that CB naught is negative for this particular one because it mimics TB. So for that the physician have advised of CB naught. CB naught is what? Cartridge based nucleic acid amplification test. That is found to be negative for TB, obviously. So this is also to be remembered that cavity formation is there in this, and that resembles the TB. So it comes in the DD of it. That's why it is important also. Right?
इसीलिए उन्होंने लिखा कि वो नेगेटिव है टेस्ट.
Actually.
And one student here is asking, Rocky Bhai is asking granulomatous. So I don't know whether it is related to this question, but I want to add one point कि एक और कंडीशन होती है जिसको हम बोलते हैं ग्रैनुलोमा एनुलर. सो ग्रैनुलोमा एनुलर अगर आपके ऑप्शन में था इस क्वेश्चन में, तो ग्रैनुलोमा एनुलर के लीजन्स भी कई बार अम्ब्लाइकेटेड हो सकते हैं, उसमें भी कई बार अम्ब्लिकेशन मिलता है, वो भी एक डिफरेंशियल डायग्नोसिस में आता है. लेकिन उसमें आपको एक पॉइंट याद रखना है कि ये जो ग्रैन्युलोमा एनुलर होता है, annular, remember that this is asymptomatic first of all, कि ये asymptomatic skin lesion होता है, and नाम से ही पता चल रहा है कि एनुलर comes from annular, so this is annular lesion. It is something like this, ring like lesion होता है, ring जैसा lesion होता है, और यहाँ पर ये इस तरह के papular lesions मिलते हैं जिनमें central अम्ब्लिकेशन मिल सकता है. तो ring जैसा एक lesion होगा, ठीक है. एंड दिस इज वेरी कॉमन इन डायबिटीज पेशेंट्स. तो अगर उसमें HIV की जगह डायबिटीज लिखा होता तब फिर हम सोचते हैं ग्रैनुलोमा एनुलर के बारे में. सो रिमेंबर दैट इन द क्वेश्चन इट वाज मेंशन इम्यूनोकॉम्प्रोमाइज्ड पेशेंट, सो दैट्स व्हाई वी थॉट ऑफ इन्फेक्शंस फर्स्ट लाइक मोलस्कम और हिस्टोप्लाज्मोसिस. बट इफ instead of HIV, diabetes is mentioned, and then they ask you about the annular lesion, which is asymptomatic and having papillary lesions with central umbilication, then you can go for granuloma annulare also. Okay.
So coming to the next one. So this is again a favorite of examiner, mycetoma.
So yes, so again a clinical presentation, and what you can see, I told you, whenever you see any image, look for the obvious thing first. What you can see a foot. Yes, and what is having, this foot is having multiple swellings. So you can see these swellings which are present here. So multiple swellings are present, and in these swellings you can see that there are few sinuses which are present from where the discharge come out. So sinus with discharge. So this is the triad which is present here, and if you find multiple swelling with sinuses and discharge over foot, and only one foot is being shown here, so that means it is localized to one foot only. Okay, so what you can think of? Yes, so many of you are already answering it correctly. Yes, Shipra, yes, Jayatvik. So this is a case of a Madura foot, that is mycetoma. Okay,
By this name also the question came, sir. So
Yes.
one of the options is Madura foot, other Jaipur foot.
So yes, so this is Madura foot, and as you all know that this mycetoma, it can be of two types. It can be eumycetoma, it can be pheomycetoma. Oh, sorry,
Actinomycetoma.
actino. I got confused with that eumelanin and pheomelanin. Okay, so eumycetoma and actinomycetoma. Okay, so when it is due to fungus, so if the etiology is fungal, then we call it eumycetoma, and actino is bacterial. Just now, sir will discuss about all the causative organism like nocardia and Madurella mycetomatis which cause them, but how they commonly present. So if you see the presentation of both these is almost similar. Okay, so you should look for these points, that is there should be multiple swellings. So multiple swellings.
We also call them tumor.
Yes, tumor. So tumor or swellings, and then there will be, so that is, yes, that is the like आपने inflammation के changes भी पढ़े होंगे है ना, collar robur tumor.
True.
So same. So swelling with multiple sinuses, and from sinuses what is coming out? There is discharge which is coming out, and the most common site is foot. So over foot you will find, so because it is present in foot, and this generally occur after plant injury, so that's why this clinical history is generally mentioned, that is a gardener or a farmer after plant injury started developing swelling over foot, and these are the exposed areas which are more prone for these injuries like foot. So swelling, sinuses and discharge, and this discharge you should look closely because this discharge have granules. Now these granules are very peculiar and they have various colors, and that's why different organisms give different colors. So this becomes very important, and this is a very important topic of microbiology. So sir will discuss this in detail.
So regarding this particular colors of the granules, definitely a lot of questions they come regarding it. So remember like this, in the eumycetoma, mostly it is white and black. Okay, in the eumycetoma, mostly the color of the granules is white and black, and this particular granules, they come in what? In the discharge. Okay, and it is a sort of a serous discharge in the case of eumycetoma, whereas in the actinomycetoma, it is mostly the pyogenic one, pus. Pus is there in the actinomycetoma, and this actino is having number of colors, like it can be white, it can be black, it can be yellow, and it can be red also. Okay, so number of colors, they are the features of actinomycetoma one, and these white and black. तो white and black जिंदगी किसकी है? eumycetoma की, और रंगीन जिंदगी किसकी है? actinomycetoma की. Okay, so in general, like sir will also agree up, you can't differentiate between both of them, but still they say that in eumycetoma there might be a single sinus and swelling, whereas in actino, number of them, numbers are there. So remember like this also, that your life is, you are single. Okay, so you should find a partner. You are single. The eumycetoma is having what? Single sinus and swelling, whereas in this actino, इसकी जिंदगी क्या है? रंगीन. So multiple sinuses and swelling is a feature of actino. Okay, but this is like not always typical, because most of the time you can't differentiate between them. Okay, telling about the like species which does it. So in the eumycetoma, remember two names regarding the white color granule stuff. One is acremonium and one is pseudoalastria boydii. Okay, very simple name are there. One is pseudo-Escherichia boydii and one is acrimonium. Okay, and they are white color granules. How to remember them? Remember in this particular way that a boy is there who applied up a cream. Which color cream? White color cream. Okay, and you also know that fungal infections are also white in color mostly. Okay, so white color stuff in the mycetoma is observed in acrimonium and pseudo-Escherichia boydii. So these two are very important, repeatedly asked. Okay.
आजकल लड़कों का फैसिनेशन भी है ना, उनको भी फेयर स्किन चाहिए लड़कियों जैसी, फेयर एंड लवली। बिल्कुल आते हैं, तो फेयर एंड लवली तो वह बिना आए भी लगा लेते हैं, तो वाइट क्रीम।
अच्छा, हाँ बिल्कुल। और ब्लैक वंस दे आर ऑब्जर्व्ड इन मधुरेला माइसेटोमैटिस, मधुरेला ग्रीसिया. ग्रीस इज ब्लैक इन color, that you easily able to remember. In the actinomycetoma there are nocardia. Okay, the brother of nocardia is actinomyces. This also does the actinomycetoma. Interesting to know is certain species of aspergillus also does actinomycetoma. This is new one for you. Okay, so nocardia, actinomyces, aspergillus, they also associate with this actinomycetoma. Fine. And in that number of species are there. In that deep you should not go, I suppose. Nocardia somalensis, Nocardia brasilensis, they are also there. Actinomyces israeli also associated with actinomycetoma. In combination also they can do. Both of them they might be seen in the actinomycetoma. So that is also there. And regarding the treatment part, sir can tell that regarding actino, what we can do. And
so as you know that whatever is causing it, we need to treat that. Okay, so mycetoma is caused by fungus, so we need to treat it with antifungal agents. So in mycetoma, we generally give antifungal agents like oral itraconazole, oral ketoconazole. See, normally ketoconazole is used topically because this is a hepatotoxic drug, and due to this side effect, we generally don't prefer ketoconazole orally. But because this is very resistant to treatment, mycetoma, so that's why we need to give antifungal agents like oral ketoconazole. While here this is bacterial, so because it is bacterial, we need to give antibiotics. Okay, so we give various antibiotics, like injectable treatment is also given, amikacin. Then we use a very old drug which comes with a brand name of Septran, cotrimoxazole. So oral cotrimoxazole, that is Septran. So these are various drugs which can be used, and the combination of these two drugs which is used in actinomycetoma is also given a name. It is known as Welch regime. So Welch regime is used in the treatment of mycetoma.
This might be asked. Welch regime. And sir, one more previous year question. The red color granules are observed in. So that is observed in a species that is termed as Actinomadure palatri. Okay. Actinomadure palatri. You can make this R capital. So by that you can remember of red color is seen in Actinomadure palatri. A palatrieri also they call it. Right? So I suppose these all covers up most of the questions of mycetoma. And one more, sir, that done by that Staph aureus.
Botryomycosis.
Botryomycosis. Yes. Okay, and what is written in that name? Mycosis.
Mycosis.
Remember, this question can again come. It is not done by a fungus. It is done by what? Staph aureus. Yes. Botryomycosis, and looks like exactly same. And in that, what you will observe when you observe the things, and you will observe under the microscope, you are able to see gram-positive cocci in that, rather than these also. Okay, very good, Rocky. Now, sir, another important one. You'd like to tell something?
So chromoblastomycosis. So chromoblastomycosis, नाम में ही लिखा है क्रोमो. और क्रोमो सबको पता है, क्रोम कलर. अभी क्रोम अगार भी पढ़ा था हमने, कलरफुल. सो क्रोम मीन्स कलरफुल. सो कैन यू टेल मी व्हाट इज सो कलरफुल इन दिस डिजीज दैट द नेम इटसेल्फ इज हैविंग क्रोमो? ऐसा क्या कलरफुल है, इसके नाम में ही क्रोमो लिख दिया. सो क्रोमो term is because the causative agents are colorful. This is caused by pigmented fungus. So these are caused by pigmented fungus. Okay, so these are colorful fungus, pigmented fungus, like Fonsesia group of fungus, Fonsesia pedrosi, compacta. सर इसके बारे में ज्यादा डिटेल में बताएंगे. सो दीज आर द कॉजेटिव ऑर्गेनिज्म, बट हाउ दीज पेशेंट्स प्रेजेंट. सो दैट्स व्हाई आई वांट टू टेल यू वन मोर ऑर्गेनिज्म व्हिच इज Pialophora verrucosa. So one more causative organism is there, that is Fialophora verrucosa. इसके नाम से आप याद रख सकते हैं, verrucosa comes from verrucous. Verrucous.
So varicose means what like?
Yes, wart like. So verrucous means wart like, that is anything which is having very rough surface. Okay, so this is wart like. So these are wart like growths which start developing, and they are also generally present over exposed areas like foot, hand, leg. So these are the areas where you will find these verrucous, rough surfaced, very rough growths, and they keep on increasing in size. So let us consider there is one growth here, another growth here, then another growth here, and it keep on increasing in size. And gradually, when you see all these growths together and which has enlarged, so you will find as if there is a cauliflower present over the leg. So that's why this is also known as cauliflower like growth, है ना. गोभी का फूल, सबने देखा है गोभी का फूल कैसा होता है, बहुत बड़ा और उसका सरफेस बहुत रफ. So growth बहुत बड़ी और surface is very rough like warts. Okay, so such large growths with rough surface are seen in chromoblastomycosis. And a favorite question of examiner, that which bodies are seen in chromoblastomycosis? Yes, they are copper penny bodies, which sir will explain. So copper penny, you can remember C for C. So chromoblastomycosis, copper penny bodies.
So as sir have already told up a lot of things regarding the fungus name, Phonecia pedrosi compacta, Filophora. So remember guys, there was a question last time in the INCT exam that which particular fungus is termed as black fungus. And 90% students, they have marked up mucormycosis stuff. So that is black
COVID
fungus.
wala.
COVID wala.
Okay.
But actually that was this, Filophora. Filophora and Cladosporium. These are two fungus which are black in color. Okay. So basically, the lesion in the case of mucormycosis is black, blackish
Okay.
scar and all. But the fungus black is this one.
Okay.
So this can repeat up again. So Filophora and Cladosporium, they are termed as black fungus, and the black lesion, blackish scar is seen in a lot of other diseases, and one of them is mucor one. Right? So that is important to remember. Another one, another name of it is what? Phuoid fungi. We call them as what? Phuoid fungi, and they are, all of them, they are darkly pigmented ones. Right? And besides this, on the biopsy, when you go for the biopsy of varicose lesion, you able to observe this copper penny appearance, also termed as medullary bodies, sclerotic bodies, and it is a copper penny appearance. And one more is there, sir. What?
Sclerotic.
Sclerotic and that muriform cell appearance.
Muriform.
Yes. Muriform cell appearance. So you can remember by this mnemonic MSC. Medullary bodies, sclerotic bodies, and copper penny and muriform cell appearance they are having. And this is the most repeated question. In last 2 years, I have seen in every exam, they have asked up regarding the chromoblastomycosis. I suppose examiner must have suffered from it. So have you seen these cases in OPD?
No, not
It's
really.
not
But
like-
this is not very common. But these findings are very important, so that whenever case come, you should be knowing these. So that's why the examiner ask you. And one more thing which I would like to add, case को याद रखना बहुत ही simple है. Copper penny. Penny मतलब क्या होता है? Coin. So these are coin shaped. So you can see all of them are round. Okay, like a coin. So penny like. And I told you that this is chromo. This is colorful. So you can remember the color which is copper. So they are copper color and coin shaped. So copper penny.
True. Right. So let's move, sir. Now coming for the STIs.
So in STI, whenever question is asked, if you read that question, one thing is always mentioned in this question, and that is, it might be mentioned patient presented with genital ulcer, or it might be present there is history of sexual contact. Okay, so whenever a question comes with genital ulcer or sexual contact is mentioned, then we many a times get confused because all the STIs are mentioned in the option. Okay, so how to approach to these questions? So remember, whenever this thing is mentioned in the question, that is history of contact or a genital ulcer, the first thing which you should look for is look for pain. Whether it is painful or it is painless, that will help you differentiate and narrow down your differential diagnosis. So if it is painful, excuse me. So if it is painful genital ulcer, then there are only two conditions which present with painful genital ulcers, and that is chancroid and herpes. Okay, so whichever is there in the option, you can choose it and the answer becomes very easy. But if it is painless, so if it is painless, then it can be syphilis, it can be LGV, and it can be donovenosis. So many a times you don't have to look for any other things, even the lymph nodes or the lesions. Just based on pain, you can make the diagnosis. If it is painful, choose whichever is there, whether it is chancroid or herpes is written, mark that as answer. And if it is painless, either of these three you can choose. But if there are more than one, like if both chancroid and herpes are mentioned, then you have to look for few other things, like The lymphadenopathy here is inguinal lymphadenopathy, which is also painful. And here, if it is painful and suppurative, that is buboes are seen, then it is chancroid. Okay, so if painful buboes are present, that is painful suppurative lymphadenopathy is present, then it is chancroid. Here also it is painful, but these buboes are not seen, these are non-suppurative, so this is herpes. One more thing which you can do is, you can do zinc smear where multinucleated giant cells are seen, and here vesicles are present, that is fluid filled lesions are present, while here in chancroid the margins are very characteristic, that is undermined. So undermined are seen, and these genital ulcers are generally multiple. So if any of these points are mentioned, then you can reach to the answer. Like if it is written multiple painful genital ulcers with undermined edges, that is obviously chancroid. If it is written that painful vesicles are present on zinc smear, multinucleated giant cells were seen, then obviously it is herpes. Then if we come to painless, then if the lymph nodes, that is inguinal lymphadenopathy, is also painless, then it is syphilis. Okay, so less. You can remember, so everything is less. Painless lymphadenopathy, painless ulcer. And remember one more thing, that whenever you find this painless ulcer, you should always palpate it. And when you palpate it, if it is very hard, that is it is having very firm induration, then probably it is syphilis. So look for this term, that is hard. And these lymph nodes which are present, they are having very rubbery consistency. So if you find this word rubbery, then also it is syphilis. Okay, so if you find hard or rubbery word written in the question, then it is syphilis. Now if the genital ulcer is painless and the lymph nodes are painful, then it is LGV. So generally unilateral painful lymphadenopathy is seen. So unilateral tender lymphadenopathy with painless genital ulcers. And remember that the genital ulcers of LGV are transient. ट्रांजिएंट मीन्स फॉर अ वेरी शॉर्ट ड्यूरेशन. आज हुआ, कुछ दिनों में ठीक हो गया. तो क्या होता है, पेशेंट को आज जेनाइटल अल्सर हुआ, कुछ दिनों में ठीक हो गया, तो पेशेंट तो आपके पास आएगा ही नहीं. पेशेंट बोलेगा ये तो ठीक हो गया, अब मुझे जाने की क्या जरूरत है. तो ये कैसे आते हैं, दे प्रेजेंट विद लेट कॉम्प्लिकेशन. सो दैट्स व्हाई व्हेनेवर क्वेश्चन इज आस्क्ड ऑन लेट कॉम्प्लिकेशन, इट इज जनरली आस्क्ड ऑन एलजीवी, दैट व्हाट आर द लेट कॉम्प्लिकेशंस ऑफ एलजीवी. एंड द लेट कॉम्प्लिकेशन ऑफ एलजीवी इज ग्रूव साइन. सो दिस क्वेश्चन ऑल्सो कम्स, ग्रूव साइन इज सीन इन. ग्रूव साइन, व्हाई वी कॉल इट ग्रूव, because if this is the inguinal ligament, so if this is the inguinal ligament, you will find lymph nodes are enlarged on both the side, leaving a groove in between. So a groove is seen in between the lymph nodes, that is known as groove sign. And if painless genital ulcer is present with no lymphadenopathy is seen in donovenosis. That's why we call them, अगर inguinal region में आपको कोई swelling दिख जाए, so swelling is present but lymph nodes are never seen, so that's why we call them pseudo. Yes sir, pseudobubos. So pseudobubos, again one important question, or no lymphadenopathy is another important question which is seen in donovenosis. And here the genital ulcer is beefy red, very red, ekdam granulomatous. If you touch it, is going to bleed. So beefy red word is written, or granulomatous word is written, or bleeds easily. So easily bleeds, if this is written, then mark answer as donovenosis. So these are some very important words or clues which you have to look in the question. So many a times the students, they get confused that how to identify LGV hai ke chancroid hai ke. So these are the clues and this is the approach how you should go. तो question आया, question में आपको देखना है genital ulcer है या history of contact है. तो सबसे पहले pain देखिए, if pain is written, chancroid herpes में से एक mark कर दीजिए. अगर फिर भी आपको समझ में नहीं आ रहा है तो look for other features like vesicles or undermined edges. Similarly, अगर painless है, then look for the lymph nodes. If they are painless, then it is syphilis. If they are absent, then it is donovenosis. And if it is painful, then it is LGV. And you can look for some other features as well.
Wonderful flowchart, sir. Sir, you can just rush down on the images.
Okay, so I'll show you a few images also, like.
That will complete this topic. No?
Yes. So like this is the genital ulcer of syphilis. As I told you, this is generally single, painless genital ulcer, and if you palpate it, it is very hard. So very hard with firm induration. Sometimes we also call it button like induration. ऐसा लगता है skin के नीचे button रखा हो, shirt का button. Very hard. So this is the primary syphilis. There are other types of syphilis also. We'll come back to this later. Like or we can discuss right now. So this is primary syphilis, but sometimes what happens, patient do not present with genital ulcers, then patient can present with other forms like secondary syphilis, which present with condyloma lata. Now why I am showing you this image here, because generally patient present with genital ulcers, but sometimes due to oral contact, what happens that oral ulcers might also develop, and we think that these are aphthous ulcer, but actually these are painless ulcers of primary syphilis. Okay, though this is very rare, but sometimes patient can present. Then secondary syphilis, one important finding is condyloma lata. Now, what are condyloma lata? These are highly infectious lesions, very infectious lesions, generally present over wet areas like groin. So these are highly infectious lesions of secondary syphilis. So secondary syphilis, this is seen in secondary syphilis, condyloma lata.
I used to tell like this, condyloma lata 2. So it is seen in which one? Secondary.
Okay.
And sir, one more is there, na? Condyloma.
Yes, condyloma acuminata.
Acuminata.
So condyloma acuminata.
And that is being done by
Yes, this is caused by
HPV.
yes, human papilloma virus 6 and 11 both come in separate option, then mark 6. This is again a one very favorite question of examiner, that condyloma acuminata, these are anogenital warts. Okay, so because these are warts, these are rough surfaced. Okay, and there is one more point which you can remember कि यहाँ पर लिखा है lata और यहाँ पर लिखा है acuminata. So if you go for the literal meaning, lata means flat and acuminata means pointed.
सर बच्चा आपकी blessings चाह रहा है यार, ऐसे मुझे भी डरमैट चाहिए.
बिल्कुल, आप मेहनत कीजिए और आपको डरमैट ही मिलेगी. My wishes are with you. All the very best. So these are flat. Okay, so you can identify it because this is also anogenital, so this is also present in groin or genital areas. So genital areas में अगर आपको flat lesions मिलते हैं, then think of lata, and अगर आपको pointed lesions मिलते हैं, then think of acuminata.
Like this also it can come in exam.
Yes.
Sir?
Then gummatous lesions, these are seen in tertiary syphilis. These are punched out lesions. So punched out lesions are seen in tertiary syphilis. These are gummatous lesions. Then tertiary syphilis can also present with gummatous lesions over oral areas. So again you can see the punched out areas, and the base is washed leather like. So washed leather base and punched out edges. Similarly, if the child which is born is suffering from syphilis, that is congenital syphilis, you can get a triad, that is Hutchinson triad, where Hutchinson teeth are seen, and these are central upper incisors with notch. So this is a congenital syphilis case.
And sir, as for the relation is concerned, the question already have come regarding the dark ground microscopy. Okay, so dark ground microscopy, everybody knows which type of light is used in this. Reflected light. Normal light is transmitted light. In this, reflected light is used. With the help of condenser, we do that. Right? So they can relate these all things with this dark ground microscopy. And if we talk about the another test, like which is the best test to assess the prognosis, so that is VDRL. Okay, and this is also important, which I think can come. What is the investigation of choice for neurosyphilis? And for investigation of choice for neurosyphilis, already asked question of INCT. Again, the answer is what? VDRL, VDRL CSF. And if we talk about the most sensitive test, that is FT-ABS, and most specific is TPI, which we do not do nowadays. And to assess the prognosis, VDRL1. And VDRL, which type of test? It's a slide flocculation test. Okay, it's a slide flocculation test. Flocculation is what? It's a type of precipitation reaction. Is it fine? So these are the various tests and all. And they can relate with this.
So here you can see one more image where you can see multiple genital ulcers. So whenever there are multiple genital ulcers, we think of chancroid. So multiple painful genital ulcers, and edges are something like this. That is, they are undermined. Yes, undermined edges. Undermined edges. Now this is a very important question, that undermined edges are seen in. So remember, undermined edges can be seen in other conditions also, like tuberculosis. One is chancroid and other one is pyoderma gangrenosum.
This I suppose is done by this Pseudomonas.
No, that is ecthyma gangrenosum. This is pyoderma gangrenosum. This is a type of neutrophilic dermatosis.
Okay.
So this is again a misnomer. Pyoderma. So लगता है जैसे infective है, but this is non-infective condition.
And regarding the organism wise, you already know this, that it is done by Haemophilus ducreae, and ducreae is having duk. So dukta hai. This particular one is painful. Okay. By this you can remember of this ducreae, and the fellow cries in pain. Do cry. Important another thing is it is having those pattern. Okay, that particular tram track appearance, school of fish appearance. Yes. Okay, and the culture media, that is chocolate agar. Haemophilus loves chocolate. Okay, and chocolate agar के अंदर कुछ added भी डालना है, that is isovital X. This might come in the INCT. So this correlation might be there in this particular one.
Okay.
Yes.
Here you can see this is that beefy red genital ulcer of donovenosis, and here donovan bodies are seen. As you all know that this is caused by Clematobacterium granulomatis, also known as Klebsiella granulomatis. So their safety pin appearance is present.
They can relate this
Yes.
also. And regarding this donovenosis stuff, you should need to know that pseudobubble stuff also. And besides this, that this is Donovan. So like one is LD bodies,
Yes.
Leishman Donovan.
Yes.
So that is observed in Leishmaniasis. The students they get confused up. So Donovan is seen in this, and Leishman Donovan bodies are seen in the Leishmaniasis. That is Kala Azar.
Okay.
Okay, and that is the amastygod form. Amastygod means aflagellar form. And in that, there is one particular thing termed as kinetoplast. And it was asked in INCT before, and they can ask again. Okay. So, and that is observed in what? Bone marrow biopsy or splenic biopsy, that amastygod form with kinetoplast. So, that I have added up. Okay.
As I told you that in herpes simplex, we do a zinc smear. So when we do zinc smear, what is seen? Multinucleated giant cells are seen. So if multinucleated giant cells are present, it is suggestive of herpes. But if on zinc smear, acanthocytes are seen, then it is suggestive of pemphigus. So sometimes they ask you this. So this you can remember. Pemphigus, acanthocytes, and here multinucleated giant cells.
And how they can relate with this micro part, they can ask herpes is which type of virus? DNA, RNA. So it's a DNA virus, double stranded, single stranded. It's a double stranded one of, because most of the DNA viruses is what? Double stranded. Fine. Or segmented, non-segmented, they can ask of. Okay, so all these are important to know. Enveloped, non-enveloped. So you know non-enveloped are only PAP, Parvo, Adeno, and Popova. So it is a enveloped one because non-enveloped are only 3. Fine. So like that, you also have to correlate up. They can show this and they can ask a double stranded, single stranded DNA,
Yes.
segmented, non-segmented, enveloped, non-enveloped. So that particular part is also important to know. Right?
Okay. As I told you that these herpes patient can present with vesicles, and when these vesicles rupture, they leave behind erosions. So many a times erosions are also present. So if you find multiple fluid filled lesions, that is vesicles, or if you find multiple painful erosions, they are all suggestive of herpes. So these patients are suffering from herpes. Now sometimes patient present with urethral discharge. There is only what? Urethral discharge present, and all of you know that urethral discharge can be gonococcal or it can be non-gonococcal. Gonococcal is caused by Neisseria gonorrhoeae and non-gonococcal is caused by chlamydia. Now how to differentiate? Here it is probably gonococcal. Why? Because gonococcal is purulent and profuse. सो अगर बहुत ज्यादा आ रहा है और पस जैसा आ रहा है, जैसे कि इसमें दिख रहा है आपको येलोइश कलर का, तो गोनोकोकल यूरेथ्राइटिस की वजह से होगा. एंड नॉन गोनोकोकल इज जनरली स्कैंटी एंड म्यूकॉइड. And as you all know that one thing more we can do, we can take the pus and we can send it to your lab, and what can be done?
We can do the from that gram staining, and in the gram staining we can observe this Neisseria gonorrhoeae. Gonococci can be observed up, and as you know they look like kidney shape. They are diplococci. They are in pairs, and they mostly reside inside the cell, intracellular, and they are pink colored because they are gram negative one. Okay, and culture media, we can put them on the culture media, this particular pus, and that the culture media famous one, Thea Martin, you must be knowing also.
Yes.
And modified neocagar. This is one of the neat PG questions. Modified neocagar is used for. So modified neocagar is used for gonococci. So somebody have gone to New York and landed with what? Gonococcal disease. Remember like this. Okay, the modified neocagar. And Thea Martin. Oh, कौन गया था? Thea and Martin have gone to the New York and landed with that. Okay, non-gonococcal, everybody knows Chlamydia trachomatis. That is there, which does this. And what is the investigation of choice for that? We rely on the molecular methods. NAT, nucleic acid amplification test is being done. And regarding the treatment part, sir will tell.
So, like all of you know, in gonorrhea, we use a combination method. That is, we give ceftriaxone, which you all know, which is one injectable drug. If injectable drug is not mentioned in the option, then you can choose cefixime along with azithromycin. And in treatment of this non-gonococcal, which is caused by chlamydia, we use doxycycline.
Right.
Now here again the patient is coming from vaginal discharge, and whenever a patient comes with vaginal discharge, then you have to think of 3 things. That is, it can be candidiasis, it can be trichomoniasis, or it can be bacterial vaginosis. Now candidiasis, all of you know, present with thick white curdy discharge, while trichomoniasis present with greenish discharge.
It can be grayish also, no, sir?
Yes.
Greenish and
So if it is colored greenish or grayish discharge, and it has lot of itching with which is frothy, and this discharge is frothy.
Right.
And if it is bacterial, then you will get foul smelling, scanty discharge, and this is having clue cells or whiff test positive. Whiff test
this is
positive.
what is Amsel's criteria.
Yes. So sir can tell more about this criteria which is used for this diagnosis.
So that in this pH goes more than 4.5. You can observe the clue cells. Okay. Besides that, that whiff test is one of this. That when you put the discharge, there is an enhancement of that fishy smell in this particular one. So this all things they come in this particular Amsel's criteria which is being used. And previously there was a criteria termed as like Nugent's criteria. But nowadays this is not being done. And mostly it is this Amsel's one which is there. And clue cells they already have asked up. And what they are actually, they are the bacteria over the epithelial cells, which you can observe up. And the drug of choice is being asked a lot of times for bacterial vaginosis, which you can tell up. It is metronidazole.
Yes.
And once it was asked in the pregnancy stuff. So in that also it, I suppose, metronidazole. Okay. And in this, sir, trichomoniasis, there was one.
So when the patient, here also the metronidazole is very effective, and you can also use secnidazole. Why? Because we prefer secnidazole because it is a single dose drug. Okay, so multiple doses are not required. So that's why this is included in STI syndrome as well, that is vaginal discharge syndrome, and we use narco kits for the treatment. Like there is one kit which is known as green kit. It is kit number 2, and in this kit there is one tablet of fluconazole, that is 150 mg, and there is one tablet of secnidazole, that is 2 gram. So what happens that this fluconazole is the drug of choice for candidiasis. So if the patient is having vaginal discharge due to candidiasis, this will take care. And for rest too, secnidazole is effective. So that's why we use green kit, that is kit number 2 for the treatment of vaginal discharge. And this is kit number 2, and this is having these two drugs. So that is how we can treat with the syndromic management as well. Now remember that recently question was asked where the patient was having cervical lesions as well, that is cervical erosion was present. Okay, so remember that if the patient is having cervical discharge, then it is probably due to gonorrhea or non-gonococcal, that is chlamydia. So then we use kit number 1, which is grey in color. So kit 1, which is grey in color, is used, and in this kit there are treatments for gonorrhea and non-gonococcal, that is there will be doxycycline for non-gonococcal and there will be cefixime for gonococcal. So if there is cervical discharge, then we give kit 1, but if there is vaginal discharge, there is no cervical lesions present, no cervical erosions present, then we give kit 2. Now there is one more question which was asked in FMG exam, and they mentioned lower abdominal pain, and whenever there is lower abdominal pain and along with that vaginal discharge was also mentioned. So remember that many students they marked green kit which is used for vaginal discharge, but green is not the answer. Why? Because the patient is having lower abdominal pain, and this comes under PID, yes, pelvic inflammatory disease. Good and one. For that we give yellow kit. So that's why the answer was yellow. So there are different color codings and different kits for different these STI syndromes.
And regarding trichomoniasis, what I like to tell you, this was question asked again in the FMG exam and All India also, that name a protozoa which does not have a cystic stage. It does not have a cystic stage. It is only having this particular trophozoite form. Fine. So this is important. Regarding Trichomonas vaginalis, they can give up in the history form, like a patient have come with this frothy discharge and all, and we could able to do the wet mount in that, and in that we see motile trophozoites. Okay. So another form they can ask, name an organism which does not have a cystic stage in the protozoa form. So this one is there, Trichomonas vaginalis. Okay, and sir, one more important feature that is termed as Colpitis macularis, strawberry cervix, strawberry vagina, is also observed in this trichomoniasis stuff. Right? So I suppose.
सर अगर आपको याद हो हम लोग एक बार सीपी गए थे तो वहाँ पर एक पब है, उसका अब तो खैर बंद हो गया, लेकिन हम काफ़ी पहले जब गए थे उसका नाम था TGI फ्राइडे. तो मैं कई बार स्टूडेंट्स को ये बताता हूँ कि TGI फ्राइडे, दिस इज़ अ फेमस पब. तो TGI फ्राइडे, so you can very easily remember T for trichomoniasis. It presents with grey or greenish discharge. It is having lot of itching and it is having frothy discharge. So if you get frothy itchy greenish discharge, then it is trichomoniasis, है ना. And C for C, ये तो बहुत ही easy है, candidiasis present with curdy discharge, ठीक है. And अगर कोई क्राइम का सीन हो, जैसे मान लीजिए कहीं पर कोई क्राइम हुआ है ना, तो हम वहां पर डॉग्स को ले जाते हैं ना, दैट गोल्डन रिट्रीवर है ना, दे स्मेल इट एंड फाइंड इट आउट व्हाट इज हैपेंड देयर. सो वी कैन स्निफ द क्लू of any foul play which has happened there in cases of bacterial vaginosis. So bacterial vaginosis में क्या कर सकते हैं? You can sniff or whiff. So whiff test, which is the sniff test, that is when you put KOH, smell will come out. So sniff, you have to sniff the clue. So clue cells are seen. And the discharge which is coming out, it is having a very foul smell. So if you get foul smell with clue cells and a sniff or the whiff test positive, then it is bacterial vaginosis. So these are few mnemonics which will help you differentiate these three conditions. Yes.
Yeah, very true. And it's a frequently asked questions.
Yes.
So with this, we end up, sir.
Sure.
And it was wonderful to be with sir and knowing so much more facts. And besides this, I suppose now you will revise up all these things, and you know that they are very high yield. They have come before, they will come again, because always one principle works, that is 80-20 principle. So that is termed as Pareto principle.
Okay.
So that Pareto principle says what, sir? That 20% of the topics will be repeated 80% of the times.
Okay.
Okay. And this you can apply in any of the life terms also. Like
Yes.
20% of the clothes you must be wearing 80% of times.
Okay.
And
Yes.
20%
There are few
books.
trousers, है ना, कि वो
which are
आप रात में
favorite of yours.
वही आपको पहनना पसंद है.
Exactly. So this particular thing always works in life, and that's why we say that you don't have to study everything. You have to be focused on the various topics which are coming again and again. Because why they're coming again and again? Because they're commonly found. Okay, so that's why they're coming again and again, and they will be asked in the future also. Fine. So that's what is logical approach. You should be doing like smart work, not the hard work. Hard work तो करना ही है, लेकिन उसे smartly करोगे तो you will have more good results. Now you want to add something, sir?
Definitely, sir. Sir have told a very nice thing, that is 80-20 rule. So definitely whatever you are doing, see, I always tell my students that it is not possible to study 10 hours, 12 hours, or many a time 16 hours. Some students, they say that we keep on studying for like 16 hours. But whatever you study, maybe you are studying for 4 hours or 6 hours in a day. Whatever you are studying, that is the most important thing. And at that time, you have to focus on that. And if you focus on that 20% or the 40% or the 60% time which you are devoting towards your study, that is going to make 80% of the difference. And if you do it smartly, if you are doing it rightly, then you will definitely achieve what you willing for. So all the very best from my side.
My side also, best of luck.
Okay.